So there's a lot that's changed about my routine when it comes to COVID. Most of it is aimed at protecting myself and trying my best not to bring any infectious agents home with me. Um, as a nurse, you're not going to work in the hospital in jeans and a t-shirt. You're always going to have changed into scrubs. I'm lucky enough to work for a hospital that provides scrubs for us when we get there. So I'm changing when I get there and then changing when I get home. So none of this stuff is coming home with me in my car or on me. The other kind of important parts are scrub caps. This is something I bought myself. I don't normally wear a scrub cap. Usually it's employees that work in the operating rooms wear scrub caps. But we're all trying to protect and prevent as much of the transmission of this as we possibly can. So I wear a different scrub cap every day. Also, eye protection. Goggles are not something that we would wear in the ICU on a daily basis unless you knew you were doing a procedure where you have the risk of splash. But we wear those with every patient interaction and frankly almost at every moment that you're in the hospital because there's some evidence that shows this transmission could occur through your eyes. Masks are a little bit more of a difficult thing to come across normally. The University of Utah Health has done a great job with their PPE or personal protective equipment. An N95 is a mask that's going to protect the wearer from any airborne antigens. I have actually had the opportunity to have a new one with every shift at University of Utah, and that's fantastic. A lot of times you're wearing an N95 and then wearing a surgical mask over that. A surgical mask is more like your regular cloth mask that everyone is encouraged to wear. But not every hospital has that. We are a travel nurse family, and I never thought that I would get to this point, but I have actually bought my own respirators and masks because other hospitals, you kind of don't know what you're walking into or what they're going to have, and you have to be able to care for your patients, but protect yourself as well. A PAPR is another type of respirator that is a wonderful thing to have if you're lucky enough for your hospital to supply it. It's a big hood that constantly pushes filtered air through so that you don't come in contact with any contaminated air. I have been thanked a lot for doing my job, for something that I consider just doing my job. And I think a lot of us in healthcare, we don't look at this like it's a choice. It's our job. It's what we went to school to do. It's what we have a passion to do. But it's scary thinking that you could bring this home with you. It's scary thinking about what could happen if you contracted this. And the majority of our patients that we see that are really sick are, older individuals or individuals with a lot of comorbidities or a lot of previous health conditions. But it's not always the case. Sometimes you're taking care of someone who looks like you, who's your age, who comes from a similar background as far as you can tell. And that is terrifying. It's frustrating to see the effect this is having on people and the effect that it has on healthcare providers, and then go to the grocery store and see people walking around without a mask. I don't think I have the words to explain the emotion that's in a room when you're about to put a tube down someone's throat to hook them up to a breathing machine because they're no longer breathing effectively on their own despite everything else we have done to try to help them. Trying to explain the necessity to call their family members, their kids, their spouse, whoever's important to them, and say goodbye because you don't know whether or not they're going to come off of the breathing machine, and a lot of them don't. That is a moment that is difficult no matter what is the reason that they end up needing the support of a breathing machine, and it's something that we do deal with in the ICU. These situations happen. Sometimes your actions and your interventions are enough to save people, and sometimes there's just not enough that you could do. But this has gone from what was more like a trickle to a waterfall. You're having difficult conversations every day, multiple times a day. And it is starting to wear on healthcare providers. We're all frustrated. We're all tired. We all are human beings. So as much as you try not to bring this home with you, it's impossible not to. And it's, we implore you to wear a mask, to protect yourself, so that in essence, you're protecting yourself, but you're protecting us. You're protecting your neighbor. You're protecting members of your extended family that would really suffer from this if they were to contract this from you who's asymptomatic. So please wear a mask so that hopefully you don't have to come see me and the rest of the people that work in the ICU.